Wellness Quiz, day 158, your health promotion and disease prevention, a podcast brought to you by Kike Afya. My name is Biri Obogo. I'm a medical doctor and specialist in public health medicine. In today's episode, I'm going to discuss an important question that I often get from viewers, and that is, how many eggs should I consume in a day? Now, here is a short quiz for which I will give the answer at the end. Akinyi received her blood tests from her doctor, which shows total cholesterol above 50 milligrams per deciliter and low density lipoprotein cholesterol above 130 milligrams per deciliter. Now, I'll tell you what these numbers mean. Her doctor starts her on treatment in addition to the TLC diet, which limits her daily cholesterol intake to 200 milligrams per deciliter. Akinyi has eliminated all her sources of animal products from her diet and has no other source of dietary cholesterol. So how many eggs per day can she consume within the TLC dietary recommendation? A, 1 egg per day. B, 2 eggs per day. C, 3 eggs per day. Or D, she should not consume any eggs at all. So many people worry about cholesterol for a good reason. Overall, raised blood cholesterol is estimated to cause 2.6 million deaths. That is 4.5% of total deaths globally, according to WHO. These deaths are mostly due to heart disease as well as stroke. Cholesterol is a fat-like substance in your blood, too much of which can block your arteries and increase your risk of heart attack, stroke, and death. So in most cases, when the doctor tells you that your cholesterol is elevated, they're usually referring to the so-called total cholesterol when it's above 200 milligrams per deciliter. So this number here is what they're referring to. Now, total cholesterol refers to the amount of cholesterol that is circulating in your blood, and it's calculated by adding HDL cholesterol, LDL cholesterol, as well as 20% of triglycerides. So these three numbers are added up to give you this number here. So HDL is a good cholesterol, which moves the extra cholesterol from your bloodstream to your liver. Your liver then gets rid of it from the body. So when you see HDL, just remember H is helpful. So LDL cholesterol stands for low density lipoprotein. This is the bad cholesterol that contributes to buildup of plaque in your arteries. You need some LDL because they carry cholesterol to your body cells, but having too much can cause problems. Triglycerides is a type of fat which can put you at risk of atherosclerosis, that is hardening of the arteries, as well as pancreatitis. So your total cholesterol basically should be below 200. Your HDL should be below 100. And your HDL should be above 60, whereas triglycerides should be below 150 milligrams per deciliter. So eggs are dense in nutrients and high in protein, as well as a good source of vitamins and minerals, including fat-soluble vitamin A, D, E, and K, as well as B vitamins, folate, and choline. So eggs are also said to be a perfect protein because they contain all the 9 essential amino acids. Now, amino acids are the building blocks of proteins. So in nutrition science, when you say a nutrient is essential, it means you have to take it through the diet. It also contains antioxidants such as selenium and carotenoids, which promote eye health. Now, the fat in the egg yolk, that is the yellow part, is in the form of saturated fats, about 1.6 grams, as well as the good unsaturated fats, about 4.5 grams. And the cholesterol is about 184 milligrams. So the yolk is a major source of vitamins, minerals, and as well as fats. Now, the good news is that eggs do not contain trans fats. So the white part of an egg mostly contains proteins, but no fat. So as I mentioned, one egg yolk has about 184 milligrams of cholesterol, making it one of the richest sources of dietary cholesterol. However, as we shall see, eggs are a very important source of protein as well as essential amino acids, and in most cases, for most people, this is a very important source of diet. So generally speaking, how many eggs should one consume? So the recommended daily limits on cholesterol in your blood, in your food, depends on the health status. If you're healthy, consuming 1 or 2 eggs a day is quite safe. If you have diabetes, high cholesterol, or cardiovascular disease, then limit your daily cholesterol intake to no more than 200 milligrams a day. That means 1 egg a day, but then you skip things like bacon, sausage, butter toast, all of which are high in saturated fats that often go along with them. Now, 2 large prospective cohort studies have looked at these questions. These studies enrolled about 40,000 men and over 80,000 women. They ate up to 1 egg a day. Now, the study showed no association between egg consumption and increased heart disease risk in healthy individuals. The other study, Nurses Health Study and Health Professional Lab Studies, showed that heart disease risk was increased among men and women with diabetes who ate 1 or more eggs a day. So what are the conclusions from these studies? 1, this research does not give a green light to eat, let's say, 3 egg omelets daily. People who have difficulty controlling their total cholesterol and LDL may want to be cautious about eating egg yolks and instead choose foods made with egg whites. For people with diabetes and heart disease, it may be best to limit egg consumption to no more than 3 yolks per week. However, for normal healthy individuals who do not have any problem with their cholesterol, eating 2 eggs a day is not contraindicated. So let's look at our quiz. The question was asking how many eggs a kidney should receive. Now, as much as we said, her total cholesterol is actually raised at 250 milligrams per deciliter. Her LDL is also raised, it should be below 100, and she's supposed to take no more than 200 milligrams per deciliter of cholesterol. That comes to about 1 egg a day. So the answer is A. So thank you very much for listening. This podcast was brought to you by Kike Afia. My name is Birio Obogo. I'm a medical doctor and public health specialist. We rely on well-wishers being with this content. So if you want to support us, we have an M-Pesa till number 766-500, or you can use the mobile M-Pesa number 0720 95 82 50. Until next episode, bye-bye.